Thank you very much. Good morning, and thanks for coming and giving me the opportunity to introduce all of you to Adam. So, Adam is a low-budget patient simulator, a piece of apparatus that we've designed and built to assist in the teaching of pharmacology here at the U of A. Very briefly, pharmacology is the science of how drugs work. So, typically you might think of drugs as being pharmaceuticals or medicines, but we're also interested in how drugs work that are used socially, whether these are legal or illegal drugs. And also drugs and toxins that you might be exposed to in the environment, perhaps poisonous insecticides and herbicides, venoms and toxins from animals and plants, or even nerve gases and such like that you might be exposed to in a war zone. So all of these types of substances would be considered drugs. But mainly, in the Department of Pharmacology, not surprisingly, our main focus is on drugs as medicines or pharmaceuticals. So, imagine you have a headache, some of you may have a headache, and you swallow an Advil tablet. So the Advil tablet is going to, after a period of time, give you a beneficial effect in terms of removing your symptoms, and eventually that effect will wear off. What happens when you swallow an Advil tablet? So the tablet passes into your GI tract, it passes down your esophagus and enters your stomach. And once in your stomach, the tablet dissolves, so now you have a solution of Advil in your stomach. That solution can then begin to drain into your small intestine. Once the drug is in solution, the Advil can diffuse across the walls of your gastrointestinal tract into the blood supply that supplies the walls of your stomach and your intestine. So once the drug has reached this blood supply, all of that blood supply initially drains through your liver, and that's your body's safety mechanism to protect you against any ingested toxins and poisons. And assuming the drug makes it out of the liver successfully and out the other side, it can then reach your main circulation, where it's then pumped around the body by your heart. So the drug is circulating around your body, and your blood vessels pass through all of your major organ systems, including your brain. And as the drug passes in these blood vessels through the brain, again it is able to move from the blood vessels out into the brain tissue, where it encounters its target and gives you the desired effect, which is, in the case of Advil, to relieve your headache. Now, as the drug circulates, it also has to pass through your liver and kidneys. And the job of the liver and kidneys is to remove the drug from your bloodstream. So as the drug is removed from your bloodstream, the concentration drops in your bloodstream. The concentration, therefore, drops in your tissues, and eventually you will lose the effect of the drug. So that's what happens after you swallow an Advil tablet. So essentially, the drug levels go up in your brain and then down in your brain in a way that mirrors how the drug changes in your bloodstream. Obviously, if we're interested in looking at how drug levels change in your brain, so that you can maybe predict how long the effect of an Advil might last for, you can't take brain samples and measure the drug in your brain, but you can take blood samples at different times and look at how the drug is changing in your blood. So if we think about how the drug changes in your blood after you've swallowed an Advil tablet, so initially, of course, there's no drug at all in your bloodstream, but as the Advil is absorbed across the walls of your gastrointestinal tract, it starts to appear in your bloodstream. So then the blood samples you're taking, you'll start to see drug appearing in the samples. And the concentration of drug will rise until it eventually peaks when most of the drug has been absorbed. And at that point, the drug levels then start to drop off as your liver and kidneys act to remove the drug from your body. And eventually, all of the drug will have been removed from your body and the drug effect is lost. If we join together the points that we've just measured, we create a graph that looks like this, or a curve, that we call a plasma concentration versus time profile, that reflects how this drug changes in this particular patient. Now, this particular patient might be a young, healthy individual, but drugs aren't always given to young, healthy individuals. More often, they're given to ill people. So we'll give the drug to an ill person, and you get a different profile. So different profile than with a healthy person. or an elderly person, or a very young person, or an overweight person, or a person with very low body fat, or a person with high liver enzyme activity, perhaps as a result of genetics, perhaps as a result of their diet, or some other medications that they're taking at this time. So what we have here are several very different plasma concentration time profiles for the same dose of the same drug in several different types of individuals. Now, the mathematical analysis of curves like these can give you lots of information on how the drug acts in these individual types of patients. And it's important for students in clinical subjects to understand how to analyze these curves and to understand what the curves tell you, because that gives them information that will allow them to determine what dose of a drug to give to a particular patient, or if they're going to be giving repeated doses, how big those doses should be and how far apart they should be in order to achieve the desired effect. And this study of this branch of pharmacology is called pharmacokinetics. You can understand it's a fairly mathematical sort of a subject. So historically, pharmacokinetics has been taught through a combination of didactic lectures and also laboratory classes where the students are able to get hands-on experience of actually obtaining raw pharmacokinetic data, plotting it, analyzing it mathematically, and obtaining these pharmacokinetic values and this information for themselves. The two lab class titles I've put on the slide here are two lab classes that I did back in the 1980s when I was an undergraduate pharmacology student. The pharmacokinetics of paracetamol in man, that's Tylenol. The metabolism of sulfadimidine in man, that's a simple antibacterial compound. So in these classes, the students, so myself and my friends, we had to take the drug, a capsule or a tablet, first thing in the morning. We would carry around a plastic jug with a lid all day, and we would collect our own urine as we went to all of our morning lectures. So we're carrying around a jug of urine. And in the afternoon, we would take the jug to the pharmacology lab, and then we would subject this urine to a number of different types of analytical procedures to obtain data which we'd plot and analyze and perform mathematical analyses and so on. Now, not surprisingly, in the 21st century, ethical considerations mean we can no longer use students as guinea pigs in that sort of a way. And also, we don't want to use laboratory animals, for the purpose of student teaching unless it's absolutely necessary. So these days, with few exceptions, and certainly here at the U of A, in order to learn pharmacokinetics, students don't get the hands-on experience that gives them a real good feel for the subject, and instead they're limited to attending didactic lectures. And so if they come along to some of the lectures in a course I teach on pharmacokinetics, they might be faced with a slide that looks something like this. This is a second-year pharmacology class. Or a slide that looks something like this. And when you look out at the sea of faces, having asked them to perform some relatively straightforward, simple arithmetic calculations, what you'll typically see is something that looks like that. And despite the fact that we give the students a handout sheet containing all of the equations that they've covered in the course that they can take to the final exam with them, so it's not an exercise in memorizing equations, it's an exercise in understanding where and when and how to use these equations. Despite doing this, the students, possibly as a result of this mental block they have around having to do anything mathematical, struggle with understanding pharmacokinetic concepts. So that's the problem. So we asked ourselves, can we do better? Can we give students a hands-on experience that's devoid of ethical concerns that will allow them to obtain their own data and analyze it and give them a real good feel for this subject to supplement what they get in the didactic lectures? So this is Adam. I'll show you a photograph in a second. Adam essentially is comprised of a number of small, inexpensive peristaltic pumps and several airtight bottles that are all plumbed together with rubbery plastic Tygon tubing in this particular configuration. And essentially what this apparatus does is if the student administers drug to the patient, either orally into a stomach compartment up here, or intravenously by injecting into an injection port in a vein here, then this apparatus models very closely how the drug would behave mathematically in the human body after swallowing an Advil tablet or injecting drug into a vein. As a drug, we use a blue dye. We do this because this makes it very easy for the students to measure the concentration of the drug simply by taking plasma samples from a sampling port in the vein or via this catheter collecting urine from the patient, and you simply measure the intensity of the blue color in an absorbance spectrophotometer or a simple plate reader in the lab. So this is Adam from the front. He has a feeding tube entering his mouth here. You can see the vein in his arm with an injection port and then a sampling port to take blood samples. And also there's a catheter here that allows us to collect urine. And the whole thing is mounted on a laboratory cart, so turned round and viewing the back, you can see we have just a simple shelving system supporting the various pumps and all the plumbing around the back of the apparatus. So we introduced Adam into a third-year undergraduate laboratory class. So this is one of our students administering drug orally to Adam through the oral feeding tube. Students taking blood samples from the vein port on Adam's arm. And round the back of the apparatus, students can observe the drug distributing round the circulation as the pumps move it round the circulatory system. They can watch it distributing into the various compartments on the back of the apparatus. And most importantly, if they look at how we've plumbed the apparatus together to mimic how certain things occur in the body with regard to drug pharmacokinetics, it helps them understand how those processes occur in the body and what the pharmacokinetic values related to those processes actually mean, what they tell you. So in addition to Adam, we also build a couple of friends, Mark and Jack. So we've got 3 of these modelers right now, and we're currently building 2 more. And what we're able to do, by adjusting the settings on those pumps around the back of the apparatus, and by changing the volumes of liquid in some of those sealed bottles, we can entirely alter the physiology of these 3 patients so that the patients behave as an elderly person, as a young person, as a sick person, as a skinny person, whatever we like. So we can make the pharmacokinetics of the same drug at the same dose change very substantially by altering the settings on these pumps. So the students attend 2 separate lab classes on 2 consecutive weeks. So in the first week, they're given this laboratory manual, which they read, that gives them the background to how the lab is going to run. And when they arrive at the lab, they're given a worksheet that shows them how to go about completing the study, and they fill in blanks and show their calculations and so on. That's what they hand in at the end of the lab to be marked. So in the first lab, the students divide into groups and they administer to their patient an intravenous dose of a drug and an oral dose of the drug. They collect plasma samples, they collect urine samples, they plot the data appropriately, they carry out various mathematical analyses on the graphs, and from that they obtain values for about 12 different pharmacokinetic parameters for that drug in their patient at that dose. The second week they come back, and again they have a lab manual and a workbook that they complete and hand in for marking at the end. And in the second lab class, they are asked to design a dosing regimen for their patient that is based on the values that they obtained in the first lab for their drug in their patient. And it's a repeated dosing regimen where they're giving the drug multiple times in an attempt to achieve a desired range of plasma concentrations for that drug. And it's a fairly complex set of calculations that they're asked to carry out. And this graph shows real student data from the students that did this lab about 2 months ago. So first of all, they're required to calculate what's called a loading dose, which is a much larger than normal initial dose that you give to the patient in order to get your drug levels immediately up into the range that you want to be at. And then they have to calculate both the size and the spacing of several smaller maintenance doses that then maintain an average concentration within what's called the therapeutic window for the patient. And we tell them what this window is. So the average concentration must remain within this window. They cannot fall below the minimum level in this window, because if you drop below that, you don't have enough drug in the system to treat the patient, so you will fail to treat. If you go above the maximum with your peak concentrations, then you're going to start to see side effects. So the peaks and the troughs and the average all must remain within this therapeutic window. So you can see with this student group working on one of those modelers, they did all their calculations absolutely correctly, and had this been a real patient on a ward, this patient would have been treated successfully and efficiently with no side effects and no loss of drug action. To assess the effectiveness of ADAM as a teaching tool then, we divided the students into two separate groups of similar numbers of students, and we also divided them up based on ability, and we did that based on their final exam marks in their second year pharmacokinetics exam. So the two groups of students overall had a similar distribution of marks and a similar average for their pharmacokinetics marks. We created two quizzes of 7 multiple choice questions each, where they were required to do some pharmacokinetic calculations and apply some pharmacokinetic principles. And they were given an unlimited amount of time in which to complete these quizzes. One of the groups did quiz A before the first lab and quiz B after the second lab. The other group did quiz B before the first lab and quiz A after the second lab. So this corrected for any difference in the difficulties between the two quizzes. And so you can see that in this matched pairs test, which we carried out to assess significance, we see an increase or an improvement in the average student score, and quite a number of the students doing significantly better in the quiz completed after they'd completed these two labs relative to how well they did before the two labs. And again, I want to point out, these students all had completed a full 12-lecture portion of a course on pharmacokinetic principles. We also assessed student perceptions of how they felt they had improved by taking part in the labs. On a 10-point scale, we asked them to assess both competence and understanding. So I'd rate my competence in using pharmacokinetic calculations prior to and after these lab modules and the results show a very substantial and highly significant increase in how students feel in terms of their competence in analyzing pharmacokinetic data and applying the principles. And similarly, I'd rate my understanding of the concepts underlying pharmacokinetics prior to and after these lab modules as, on this 10-point scale, you see a very significant increase and a substantial increase in how well students feel they understand the material. So they've lost a lot of the fear that they associated with working with this mathematical subject. And finally, we assess student satisfaction by asking them on a USRI type scale to strongly disagree up to strongly agree, with several questions on the setup of the lab. How well had we managed to create a useful learning environment that they had found had advanced their understandings and advanced their competence? And probably the most important question to look at here is the fifth one. The lab protocols were an effective educational tool in regards to my overall understanding of pharmacokinetics. So you can see that there was very strong agreement amongst this cohort of students that they felt that ADAM had really advanced their understanding and their competence in the subject. So finally, what are the potential technological impacts, and what have been the technological impacts thus far? Well, we feel that this modeler, or these modelers, allow students to develop competence and confidence in using pharmacokinetic equations and approaches to design patient-specific dosing regimens, and that's the critical point, in a risk-free setting. So it doesn't matter if they make a mistake here. And that's critical. There's no harm can be done. And this should improve patient safety. Every year in North America, tens of thousands of patients die as a result of dosing calculation errors. So if by becoming comfortable with these concepts, by using these modelers, we can reduce even by a small percentage that number, then that's a significant number of people are not going to suffer as a result of these calculation errors. The modeler was also very recently highlighted on local CTV News and on local Global Edmonton News. And with the help of Tech Edmonton, we recently filed a provisional patent application in North America, and so we are now looking for a partner to help us develop and market these modelers for much more widespread use than just here at the U of A. So I just want to acknowledge, first of all, my master's student, Ines Zuna, who's sitting up at the back there. So Ines, wave to everyone, Ines. So Ines is the person who, after I'd had the original idea and built the first modeler, she did all of the very extensive testing that we carried out, that then led to some further improvements on the modeler. She's written the manuscript, she designed the student labs and the questionnaires and so on. So she's done all the work, and that will constitute a significant portion of her master's thesis later this summer. Ines, no pressure. Dr. Ken Kaur from CTL, who helped us design the student questionnaires. And the funding to build the apparatus and also for Ines' stipend came from CIHR, a grant from the Teaching and Learning Enhancement Fund here at the U of A, and also some funding from the Department of Pharmacology and the Faculty of Medicine and Dentistry. Thanks for your attention. I'm happy to answer any questions.